everyone. I'm Tim Tuccaro. I'm a professor emeritus here in the Faculty of Health Sciences, and I'm really happy today to welcome you all to the seminar. We are here on unceded territory of the Musqueams, Tsleil-Waututh, and Squamish peoples, and many other Coast Salish. I would just like to have us think back 175 years when the waters of these mountains had streams just running with salmon. And for 4,000 years, or maybe 10,000, maybe 15,000 has been some archaeologic findings from that time. People took care of those salmon year after year. They enabled the salmon to come into streams that were plentiful with life. They took care of the forests. And in return, the salmon came twice a year, every year, and in abundance that was unbelievable to us. So I appreciate that stewardship, and I hope we can find it again. With that, I'll welcome Amy, a colleague from years back. Our careers intersected at the University of Washington. I have a bio that's actually really good, so I'm gonna
it's too long.
I'm going to note a few things about it. So Amy's work is in how the maldistribution of power and wealth undermines health. We taught several classes together on war and public health and environmental determinants of health. She's currently involved in projects that improve the methods to count homeless people outdoors and the human right to housing. A lot of her activities now are through the American Public Health Association. And I think this is an inspiration for all of us to be engaged in our community, our public health community, and to make a difference. Amy.
Thank you, Tim. It's so great to be with all of you, and I so appreciate Tim and Kate's work to bring me here. I took the train up yesterday. It's a lovely ride, and Amtrak was actually on time. It was remarkable. So my computer is precariously balanced here on a Clorox box, so let's hope nothing goes wrong. All right, so what I mostly want to talk with you today about, let's see if this figure out the right button to push, is public health and how we think about war in relation to public health. So first of all, public health, which to me, having been in this profession much of my life, I think about it as the project of improving the well-being of people everywhere by tackling problems that pose threats to health, which is a fairly broad mandate, and you can think of lots of things that fall under that. Unfortunately, among public health people in our profession, rarely do they think about war as a public health problem, and that's what I want to challenge us to think about today. So first of all, what is war? And this is my own personal definition. My own definition is that war is organized conflict perpetrated by those with power in pursuit of their private interests. These forces have the power and wealth to assemble weapons, conscript troops, and frighten people in lots of different places around the world all the time. So here's a thing to think about, and I apologize in advance for this talk being fairly US-centric, and I realize I'm not in the US, so call me out on this anytime you like, and you're welcome to interrupt me at any point and challenge something or ask something at any point in this talk. But here's a thing to think about from a US perspective. So the US and our allies haven't won a war since 1945. But we've been in lots of wars since then, right? So we lost in Vietnam, we lost in Korea, we lost in Iraq and Afghanistan. We were on the wrong side in the Central American wars, and the consequence of that is visiting us on our southern border constantly to this day. So why do we keep fighting wars that we don't win? Who does that serve? You might ask yourself. Well, here's one answer. Every time a bomb drops, somebody makes some money, right? This is a very profitable business, war. Come on, thing. So these powerful companies and their owners and executives don't send their own kids to war, of course. So war serves them. War isn't a manifestation of interpersonal aggression. It's not about anger or human nature or human emotions. It's a display of power and wealth by ruling elites. I think some people think war is inevitable because it's an expression of human nature. And I think that's a very perverted idea about human nature and fails to appreciate what really drives the cause of war. Still, I would say our profession, while we ignore war, still has shown some history of bravery in going after power and wealth. Our profession has done some remarkable things over many generations, some of which required standing up to powerful people and their interests in tobacco, in the automobile manufacturing industries, in gun violence, in racism. Public health has been, I think, very forward-thinking about how racism undermines our health as a society. We've also advocated for safer and healthier foods, and we've stood up for reproductive health rights. I think our track record in public health is pretty good overall, but on this one issue, we have failed, I think. And so in public health, we often think about poor health being produced by the unintentional side effects of pursuing the things we like, right? So we like Cheetos and red meat. We like to doom scroll and drink whiskey, all of which is bad for our mental health and well-being. But we also like warm homes and fast cars, even though we know getting those things generates waste, which has to go somewhere. The funny thing about war, though, is that it's not the byproduct of something we like doing, unlike those other things. War is not an unfortunate thing. It's just a bad thing. And I'm afraid we haven't yet imagined a world without it. And it's time to do that. And I'm going to make a case for that here. So the World Bank estimates 2 billion people, a quarter of the world's population, is now living in areas affected by conflict. The 20th century saw 200 million conflict-related deaths, and civilians are increasingly the targets of all these wars. 1 in 7 World War I deaths were among civilians, and civilians accounted for 2/3 of World War II deaths and 90% of deaths in some of the 1990s conflicts. So, you know, people in harm's way are not just the people fighting these wars. And there's a lot of wars going on right now. You don't read about them. Many don't make it into the news at all. And then there are the wars, of course, that are constantly in our news, like Gaza and Ukraine, and we'll talk about those. But Central African Republic, Congo, Tigray, Mali, Myanmar, the Sahel, Somali civil war, the Syria conflict, Sudan, and Ukraine. Those things, what are you pointing? Armenia? I had it there and I took it out because, yeah, whatever, we could talk about that. And yet you will notice that our state and local federal health officials have their heads down working on important problems like gun violence, suicide, homelessness, drug use, cancer, and heart disease, right? They can't be wasting time working on problems that aren't right in front of them. They're busy here, right? And so my argument here today is that all those problems that I just mentioned have connections back to exposing people to war, the diverted resources to the military, and the militarization of our society. APHA, the American Public Health Association, adopted this statement back in 2009, a statement I'm proud to have worked on, but which is under attack at the moment. And I'll say that professional associations are debating across our countries, both of them, I think, around Palestine, and are really encountering some amazing pushback on these things. Has anybody followed these things in the news? The American Historical Association? Anybody follow this? No. Okay. So this is a picture of the meeting in early January in New York City of the hundreds of members of the American Historical Association who voted for a statement condemning scholasticide in Gaza. And after everybody went home, having had that overwhelmingly supportive vote on that statement, the upper echelon of the organization voted to repeal it. 12 people. Because powerful people in these organizations, all of them, including APHA, are going around systematically shutting down these conversations in Palestine. It's really embarrassing and remarkable. Modern Language Association is another one, tens of thousands of people who teach English language professions. American Federation of Teachers, I went to their annual meeting last summer in Houston. All our resolutions on Palestine were systematically shut down. So these professional associations could be the source of some bravery and some statements that might make a difference in public policy, and they shy away. So during this talk, I want to talk about different ways of thinking about measuring harm in war. And so to start, I'll share with you a little data from a study that Tim and I worked on in Iraq to measure direct harm, that is, people killed in the conflict. So this was, of course, the 2003 Iraq War that George Bush entered us into. All of you were maybe barely born then. It's remarkable how I've been talking about this topic for 20 years now, and I realize some of my audiences don't even remember the day that war started. And of course, it's vividly burned in my memory. So a lot of politicians in both parties supported this war, of course. Soldier deaths are relatively easy to count. These are all registered people who are conscripted into armies, and armies have a motivation to keep track of this. This is a graphic from some newspaper showing the American deaths, soldier deaths, where, of course, the modal age of death is 21, remarkably young. Remember, the US used to have a draft? And that's how we got all those young men killed in Vietnam. And Vietnam was shut down by being an extremely unpopular war. And the military authorities decided they'd better drop the draft. It just wasn't working. It conscripted too many people who weren't going to really be willing to fight these wars. So then they switched to volunteers. And I'm going to talk more about recruitment and the nature of volunteers in war later in this talk. I just want to note here that the soldiers dying are those who are disproportionately young and, of course, poor, because that's who volunteers. Volunteers. Let's see here. So this was our study conducted in 2011, which was to count the Iraq population deaths stemming from the 2003 US invasion. And your university was a part of this through Tim's engagement. That's our little team in downtown Erbil. I don't know why you're not in this picture, Tim. I think you were
Nancy
at this.
was-
Maybe you were taking the picture. But Lindsay Galway was a PhD student here at the time, and she led a very important part of this study, which I'm going to focus on a little bit. She designed the sample selection method. So this was a cluster sample method of measuring mortality, which is a well-accepted method internationally for measuring all sorts of health problems, knocking on doors using randomly selected neighborhoods. In this case, we decided to have a sample of 1,000 clusters of 20 households each, so that we'd have 2,000 people in our study. Cluster sample surveys are well accepted way of making population health estimates, but there was a long debate on how to select and navigate the clusters in our survey, especially in Iraq. If you look at this nighttime visual of the map, you can see there are large unpopulated areas of Iraq. So you can't just take a map and randomly select neighborhoods, because in some places there aren't even neighborhoods, right? So this was a really challenging problem for us, especially since the couple of studies that preceded ours were critiqued heavily for having a biased selection process for our clusters. So we used Google Earth maps, which were overlaid, on which we overlaid a grid with squares calibrated at a square kilometer, and then randomly selected 100 of those across Iraq. And because Google Earth maps were loaded with population data, we were able to generate a population proportionate to size sample. People know that method. You should learn this. It's an important method. One reason it's important is because if you select a population proportionate to size sample, you don't have to recalibrate it or reweight it based on the way the population is actually distributed. So it's a powerful method. And in each of these clusters, we then overlaid another grid and randomly chose a start house. And I'll show you what this looked like. So this was the initial grid, and then this was the next grid, and this is the dropped points. These are the randomly selected things. And so here's a cluster, for example. And when we arrived in Erbil, Lindsay had printed out some maps for us, and we were able to actually walk around the city and find the clusters that were prepared for us, which was an amazing thing to be able to do. And there we stood on the street corner looking at our maps. It's very fun. That character in the middle is Riyad Lafta, who was a professor at Mustansiriya University, who was a key character in all of our work there. And actually, to finish up an earlier study, we wanted him to come work with Tim and me. We tried to bring him to Seattle, but he couldn't get a visa to get into the US. And amazingly, he did get a visa to come to Canada, and they opened up a direct flight from Iraq to Canada, which allowed him to come. Going through UK didn't work because he couldn't get a transit visa through the UK. This was all very highly orchestrated repression, really, in many ways. So our household survey collected information from the head of each household about who lived there, who'd been born there since 2001, who had died, and their causes of death. And in this way, we learned about the status of 10,500 household members. We also asked each adult in the household to tell us about their siblings, their adult siblings scattered elsewhere around the country. And because family size is big in Iraq, we were able to learn about an additional almost 25,000 people this way. It's kind of cool. And so there's this formula for calculating rates based on the denominators and the numerators and multiplying them times total population size, and you can estimate excess deaths, not all of which are attributable to violence, by the way, just excess deaths. So I'll get into more of that. So in this figure, we illustrate the adult deaths per week during the study period based on the sibling survey. And for the years 2005 to 2006, you can see there were 755 excess deaths per week, with 73% of these attributable to war-related violence. Can you imagine the carnage? You'll notice the orange portions of the bar show war-related deaths not caused by direct violence. So these are excess deaths that were not being shot, but were the consequence of all the many things that go wrong in a country when you're at war and limit access to healthcare or communication or transportation, and therefore people die. Here's a figure from our study showing specific causes of death among household members, both in the period immediately before the war and throughout the conflict. And you can go to our paper and read all about it. And this was our team meeting in Erbil at the end to analyze our results. It was a fairly contentious, rocky meeting in many ways, partly because the death count was not what we had anticipated it would be, and we had to figure out how to make accommodation for that. So you can read all about it here. I want to next point you to a brand new study that just came out in the Lancet, which I encourage you to read. It's really short. So these folks just published this paper to try to estimate mortality in Gaza since Israel started bombing in October of 2023. The authors used this capture-recapture method, which is something used in ecology to study things, but can also be adapted by public health. So they had 3 lists. They compared deaths captured by Palestinian hospitals, which included all sorts of very specific data about people, their ID numbers, their names, their grandfather's names, their family name, their age of at death, and their sex. And they were able to match these individuals to a list of deaths captured by the Ministry of Health in an online survey. And then they had a 3rd list of deaths that they captured from social media obituaries. So when people die, their family members uploaded obituaries to various sites, and they were able to analyze those 3 lists against each other and do various calculations. And they estimated in the end 64,260 deaths from traumatic injury during the study period, all of which suggests that the original Ministry of Health estimates, which come out regularly from WHO and other places, suggest those mortality rates were underreported by more than 40%. This was carnage, clearly. And now people are trying to go back. This is a photo I took of a scroll carried by protesters at March in Seattle in November of 2023. So even a month in, there were already this many deaths.
The scroll appeared here on campus.
Yeah. So when was that?
November.
Yeah. Yeah. I mean, now you can't get 64,000 names on a scroll at that size. Yeah. Okay, so those were trying to measure direct deaths. Let's talk about unintended, but also direct. So those other ones were, we are deliberately trying to kill people, and we successfully did kill people, and how many were there? So these are some unintended deaths. So the US has 23 million military veterans. That's a lot of people. And studies of their health indicate they have poorer overall health and in many specific problem areas. They have more limited activities, they smoke more, they drink more, and they have more heart disease, more cancer, and more depression. And we know they are disproportionately more likely to be homeless as well. Here's another direct but unintended consequence of military service. Jessica Turchik researched sexual assault within the military, soldier-on-soldier assault, finding 1/3 of women in American military units reported military sexual trauma. Those most at risk, of course, are younger, less educated, non-white, single, and in lower pay grades. Unsurprising. One thing to note, though, is that as many as 12% of active duty male soldiers also report sexual assault, which, by the way, is a lot of men, 12%, even though it's a lower percentage than among women. Let's also talk about the role of the military in climate change. Militaries across the globe are huge consumers of fossil fuel. The US Department of Defense is the single largest institutional fossil fuel user in the world. And since 2001, the military has been responsible for up to 80% of federal energy consumption. Military bases are associated with poisoned wells, noise pollution, leaking chemicals, and unexploded ordnances. Chemical weapons, of course, are now banned, and the US has destroyed most of our stockpiles, but sometimes this stuff turns up in the darndest places. People apparently forgot that there was a chemical waste dump in this neighborhood in Washington, D.C. Do you know this story, Tim? Yeah. And they built fancy, expensive homes on top of this waste dump, but people were getting sick. And what the heck is going on? And of course, so they explored and investigated. And I'll just say it's a good thing it was a rich neighborhood, because they were able to get an exploration and a reparation for that. And here's another disturbing thing. Of course, militaries dump lots of horrible things in our oceans. And the military, of course, is guilty of a lot of environmental racism. The locations of toxic sites are often proximate to minoritized communities. The US military conducts open pit burning of all sorts of things, from tires to chemicals, and in its theaters of war, you'll recall Joe Biden's son died of cancer. And one of the, sort of remarkably, the son of a sitting president actually served in Iraq and got exposed to these open pit burning situations. And they think that is where his cancer came from. So, indirect harms. The US defense budget request for this year was $850 billion. Canada's military expenditures are only 40 billion. So you people need to hurry and catch up. And our president is going to tell you how to do that right quick. So WHO's program budget is less than $7 billion. You can't even see that against this, right? Hardly a blip. But of course, our new president is now pulling us out of WHO, so there won't be a problem with this anymore, right? That budget, that $7 billion budget, will even decline further. So there's that. You have to revise that. Yeah, we will. This is one of my favorite studies of all time. Use it because it uses population attributable risk, one of my favorite calculations in public health, which takes a problem and determines what exposure causes what percentage of that in the whole population. And this is a study by Holly Prigerson and her colleagues, who wrote this paper using 1990s data long ago. And they found that 1 in 5 instances of partner abuse in the United States could be attributed to the exposure to combat. 1 in 5 across the whole United States, including, that's so many people, most of whom are not, of course, exposed to combat. And that was a very old study, so of course it might be very different now, probably worse, but that sort of study is hard to do and was never repeated. This guy does some interesting work, I think. This is Diego Gutierrez, who has studied bereavement as an indirect harm of war deaths. He's developed a method for measuring the number of family members left after a war death, which he applied to the Rio Negro, a population in Guatemala. And there he found that 1/3 of the population was killed in the early 1980s genocide there, but 2/3 of the population was left bereaved. grief is a very harmful thing, and of course, it's a huge byproduct of war. Suicide among veterans was the 4th leading cause of years of potential life lost in this 2019 study. Youngest veterans are at greatest risk, as you can see by the red line. This report is remarkable for the size of the study population, more than 16 million person years in the military's defense medical surveillance system. The leading category of hospital discharge diagnoses among service members was a mental disorder. This study came from an analysis of 75,000 service members, finding a linear relationship between age and the proportion of the cohort with problems associated with PTSD, depression, panic disorder, anxiety, alcohol, and eating disorders. Again, the youngest service members are the most harmed, which is, you know, younger people are supposed to be healthier, right? But we're really doing harm to our young people who go into the military, volunteers. This is a study of 500,000 Afghanistan and Iraq veterans who visited a VA facility after leaving the military, finding high rates of substance use disorder, especially among the youngest again. My friend and colleague Kim Koronek has studied the effects of combat exposure on long-term health among people in North Vietnam. And it turns out exposure to combat is also associated with many chronic illnesses, sort of maybe unexpectedly, including cognitive decline, both in soldiers and civilian populations. So another indirect effect of war on our nation's health is having a society that gets bogged down with militarism. We all noticed America's remarkable national response to the murder of George Floyd in Minneapolis at the beginning of the 2020 COVID pandemic. It's remarkable that those two things occurred at the same time. And still, there were many, many street demonstrations that people came out to, or maybe it's because of it. That was a way to get outside, and people were motivated. Many American policemen served in wars, Afghanistan, Iraq, other places. And because when you get out of the military, what are you going to do? What have you done that prepares you for a good paying job? Well, in Seattle now, to be a policeman, and starting wages are well over $100,000. 3 requirements. You have to be 20 and a half years old. You have to have a GED, and you have to have a driver's license. So that attracts military veterans, and they have been trained to kill, and they do. And Seattle police spark a lot of fear among the population. Militarism is pervasive in US high schools. I don't know how your recruitment goes, but in our high schools across the country, especially in the South and the Midwest, military recruiters are paroling the halls and in the lunchrooms all the time. National legislation requires schools to open their doors to military recruiters and to turn over names of kids with their phone numbers and addresses. When the US invaded Iraq, I had a kid at Garfield High School in Seattle, and I was active in the PTA, and we passed a resolution opposing the increasingly aggressive military recruitment in our schools' hallways. We actually got some international press attention for this. This was me, picture of me confronting a military recruiter in my kids' school lunchroom, which made the front page of our local newspaper. We also, a colleague and I published this paper in the American Journal of Public Health about recruiting as a threat to public health, and assembled the evidence for that. And we suffered some consequences, needless to say. So I just want to talk for a bit about what I think we can do about all this. This was sort of an array of methods to measure the harm of war and ways to think about bringing war into the public health profession as a mainstream study topic. But I think also our role as public health people needs to include some activism to stand up to normalizing war as a response to international problems. So I'm just going to quickly go through my little list of things we might think about, and then let's have conversation. So I would not rule out direct action as a way of protesting war. This was our team in 2003 at the onset of the Iraq War. This woman in the blue jacket in the middle, she's pregnant in that picture, and that kid is now in high school, of course. So we made this friendship by adopting a sister university in Basra, southern Iraq, and that is Janan Hassan, who we brought to Seattle, took her to the state capitol, and we wrote a paper with her. We continued a friendship and relationship with her. That is a thing academics can do, is reach out across international lines and make friends with other academics as sort of a two-track diplomacy activity. We bring speakers to campus constantly. And here's an example of some posters of people we brought. We can teach classes. There are actually very few classes taught in American schools of public health about war and its relationship to health. And do you have a class on war and health here? No. Okay. I think it's important to protect whistleblowers who often bring to light some of the harms of war that we would otherwise never know about. We owe them for the risks they take to inform the public, and we should defend them when they need it. This is Julian Assange, who is now finally out of British prison and finally free of the threat of having to be to face the American judicial system for revealing the war crimes of American soldiers in Iraq. This guy, John Kiriakou, was a CIA analyst who exposed the CIA's torture program. No one who designed that illegal program ever went to prison, but he did. He served 30 months in jail, and he lost his pension for revealing the existence of this illegal program. We have to protect these people. There's a very interesting story about how Kiriakou went to Trump at the end of his last term and asked for a pardon for that, and was told he could have one for $2 million. Look that up. It's a really interesting story. So Noam Chomsky, you know, the world's leading intellectual, probably, has helped us understand that warmongers are in close collaboration with commercial media and help to sell wars to the public. And this whole idea of manufacturing our consent for wars is a very important idea that you need to be vigilant about. I encourage you to think carefully about curating your news sources and following good sources so that you're aware of how your consent is being manufactured for the next war. We need strong, inclusive, justice-oriented global institutions. World peace requires it, and we need to reorganize our Security Council so that the nuclear powers in the world can't veto important declarations that the rest of the world would like to move forward. The International Sustainable Development Goals list, way down at the bottom, acknowledges the importance of peaceful and just societies, so there's that at least. We can use that. Humans have a long history of creating international agreements about use of force. The St. Petersburg Declaration of 1868 banned certain kinds of bullets, for example. The 1899 Hague Declaration rejected the use of projectiles for delivering poisonous gas. The 1972 Biological Weapons Treaty appeals to the conscience of mankind. In 1993, the world banned chemical weapons. The Landmine Treaty was adopted in 1997, although the US has never signed on to that, sadly. The Cluster Munitions Treaty was in 2008, and the 2017 Treaty on the Prohibition of Nuclear Weapons entered into international law in January of 2021, with 93 nations endorsing. Ours, of course, is not among them. The US is planning to spend more than $1 trillion over the next 30 years upgrading our nuclear weapons arsenal. Advocacy organizations are trying to derail that project because every dollar spent on our nuclear arsenals is a dollar stripped from critical social programs, including housing, food, and healthcare. There's a global alliance on war, conflict, and health with more than 100 members, most of them academic. I didn't notice Simon Fraser on the list of members, but Toronto is, University of Toronto. Physicians for Human Rights now has a website portraying ways in which police violence has played out around the United States. And this is a thing to keep an eye on because the relationship, I think, between police violence and war and militarism is very close. In Seattle, our School of Public Health worked with our local ACLU chapter to catalog the weapons used and injuries inflicted on protesters by police during the Black Lives Matter protests in 2020. And we published a website, which you can go to, SPD Violence 2020. We recently had to pull this out again because our city council is backtracking on restrictions on police for using those kinds of weapons against crowds. So there's the website. There's a little webinar there too, which we were able to get our Dean of Public Health and our Dean of the Law School to co-sponsor this webinar, which was kind of a remarkable feat. Yeah, let's skip that. Arts are another way, I think, to advance public thinking and attention to war. And Banksy is sort of a renowned pro-Palestinian artist who has lots of visuals in public spaces. And of course, we have to talk explicitly about the situation in Gaza, described as one of the fiercest attacks on a civilian population in recent history. This is a photo of Khan Yunis, the city in southern Gaza, where Israeli forces directed people to go to escape the bombardment in the north, and then they were bombarded there. So there was recently a study by a University of Pennsylvania scholar, Ian Lustig. Anybody notice this one? Where he says the only thing that has ever stopped Israel's previous attacks on Gaza, and there were many, many, was the United States saying to stop, which suggests that political pressure makes a difference, and that's on us to impose. I received an email from Amnesty International this very morning, noting that it has been more than 3 weeks since anyone has heard from Dr. Hussam Abu Safia, a pediatrician and the director of the Adwan Hospital in northern Gaza. In late December, the Israeli military raided his hospital and arbitrarily detained him along with other medical staff and patients. His hospital was one of the last functioning hospitals in Gaza, and it was shut down completely in the raid. And so people are still searching for him. Where did he get taken? Where is he being held? What are the charges against him? Israel has acted with a lot of impunity and a lot of support from America. The WHO tracks these many measures of ways in which Palestine has been harmed during this war, so you can follow that. And, we talked at the beginning here about the wallpaper in public health, public health workers thinking about war as wallpaper, what's happening in their background while they're busy here doing more important things. And I think it might be time for thinking about a new wallpaper. And I think sometimes it's easier to imagine the end of the world or than it is to imagine the end of war or capitalism. And that's why I like this quote by Angela Davis so much. We have to act as if it were possible to radically transform the world, and we have to do it all the time. I love that quote. Okay, so that's it. That's my dogs, says hi. I have an ad though I want to share with you. This is a personal plug. This summer, I'm taking a study abroad group to Uganda, and non-University of Washington students are welcome to join this trip if you're interested. We're going to go middle of July to middle of August, and we're going to study one large public health problem, which is last August, there was an avalanche at the municipal waste dump, and 21 people died because so many people are living in slums right around where the dump is located. So we're going to interrogate that problem, the policies and practices of waste disposal, and some of the other countries where this same thing has happened. It'll be great fun, and I encourage you to join us. Just drop me an email if you're interested. Okay, time to talk. Just shut this down. Oh, no, I can't. I can't, no. So I'll just do that. Do that, and I will, but I think I will change my screen sharing, okay? Basic. Oh, I could, right? I'm not seeing anything. What's happening here?
I put up your last slide.
I don't need to share anything though,
No,
do I?
no.
Yeah, I can just be me. Okay, all right. So questions in the room or online, anywhere? I'll let you decide this.
All right, there's quite a few online. Actually, there's a request whether you would be willing to share your slide deck.
Sure.
From multiple
Happy
people.
to. Mhm.
Terrific. And then
I'll send them to you. Okay.
and many thanks on there. And I think Chris, you're up first.
Yeah, thanks so much. A great
Just
presentation.
realize that we cannot hear you. One sec, Chris. Amy, if you can increase your volume on your laptop, you'll be feeling it.
Testing. Am I coming through? Thanks for troubleshooting that, Kat. And Amy, really nice to meet you. Thank you so much for a great presentation. I have such a deep appreciation for the importance of your work centering war as a public health concern. I guess I'm curious, given all the rhetoric around trade wars dominating our current news cycle, I'm wondering if you have any insight into this as a research area, given its, very obvious implications for the social determinants of health. Just any thoughts that you've got on how we would go about quantifying some of those direct and indirect health impacts of these so-called economic wars that are currently being fought and or soon to be fought?
Yeah. There are public health people who focus on trade as a social determinant of health, and actually APHA has a trade and health forum, which might be a place where you can go find more information about that. In Seattle, we have a trade and health group because as you might remember, we had those giant demonstrations in Seattle about 25 years ago. Opposing the World Trade Organization's efforts to, rescind health restrictions, health protections in manufacturing and in trade. Clearly one of the reasons that Donald Trump won this last election in the United States is his appeal to the working class that was clearly cynical and shallow. But the working class does understand that powerful interests are not on their side, right? And so he can point to these trade deals, that, as he calls them, as ways that have moved jobs offshore to lower cost manufacturing bases, Mexico, China, places where health protections might be lower, certainly wages are lower. And so the goods that we can import from those places will make more profit for the manufacturers. And that message somehow got through to working class people, and many of them made some poor choices as a result. But I didn't ever hear Mr. Trump or his people talk about extending workplace protections as an international requirement of manufacturing before trading. I didn't see anywhere wage protections that might extend internationally. You know, one big union might be an idea there. So I'm not sure if that's what you were looking for, but there are people who work on this. I noticed APHA did take a stand a couple years ago on a piece of legislation in New York State that was aimed at indebted countries and the ways in which lenders, private lenders, the IMF, all sorts of organizations go after indebted countries to make sure that they are paying their debts instead of spending money on public sector healthcare or education. And so progressive people in New York State have found a handle on that sort of legislation there because Wall Street is located in New York. So they have a way that they can impose some restrictions on decisions made on Wall Street. I thought that was a very clever approach to this. Did you want to add something?
No, that's great, Amy. Tons of great leads in there. Thanks again. I'll open up the floor for someone else.
Okay, great. So who do we have next?
If there's no.
Anyone in the room?
Yeah, see, can you just project?
Or come up here? Yeah.
I guess, you kind of referred to the tensions within scholarly associations around position taking, right?
Yes.
And I guess I just wondered if you could talk a little bit more about that in terms of, the balancing or addressing, freedom of academic expression and all of that. And also actually from the point of view of the effect of those debates on the scholarly work environment, right?
Yeah, so the question was about position taking within professional and scholarly associations and what the effect of these positions might be and why these debates have been so contentious. Well, I mean, the debates on who is responsible for what's happening in Gaza, of course, are contentious everywhere, not just in our associations. Those are just interesting gathering places for scholars to make their voices heard. And I think in general, the places where associations have democratic processes for making decisions, their statements are likely to be more progressive than in places where they're not. At APHA last fall, we had a lengthy and I think fairly well considered proposal on Gaza, which was barred from even going to the governing council floor. We weren't even allowed to get a vote on it. It wasn't even allowed in the hearings. The people at higher echelons in these associations know how to shut down debate, and they do. And I think one of the reasons they do this is they know it's important. We have history to show us that when associations take these stands, it does make a difference. It made a difference when we debated apartheid in South Africa. it really changes public opinion when strong consideration by people with knowledge and history and standing make statements.
I guess one of the difficulties that we've seen is around also the, the equitableness of position taking. There was a long list of conflicts that were going on. and yet
Yes, yes.
Those,
So why don't these organizations take stands on some of these other conflicts, right?
or what is the consequence of continuing to take stands on some conflicts and not others?
Yeah, well, as is obvious, these statements come from the membership who are volunteers typically. And staff don't sit around writing these statements. These are volunteers. And so what are volunteers motivated to write position statements on? Well, the things that are in the press, the things that get the most attention. Do we have a statement in APHA on the conflict in the Sahel, which has been going on for decades? No, we don't. We don't even have a statement on Ukraine, interestingly. So yes, it would be great if we did. That generic statement on the role of public health workers in war is currently undergoing a rewrite through a very tortured process that has forced people into the room who disagree with each other on almost everything. And I don't know that it will produce anything very successful, sadly.
Amira?
Hi, so thank you so much for that wonderful talk. And just a quick comment before I get to my question. What I really appreciated as well was your use of the word Palestine and Palestinians, and not just talking about Gazans and Gaza, because this is yet another indirect way the media tries to separate Palestinians. And for example, what's happening in the West Bank right now, where things basically the war is now being moved to the West Bank, is being completely ignored because we've been programmed to only think about Gaza. So I really appreciate the fact that you use the word Palestine and Palestinians. And as a Palestinian, I thank you for that. My question, though, is regarding funding and the crackdown right now. And I'm based in the US, so I'm sorry, this is going to be a US-based question, but the crackdown on any conversations around conflict, from Trump putting in an executive order right now to deport international students, to wiping out the NIH websites even from any mention of justice or any of these kind of things. So I'm really concerned about how to get funding to continue research around these topics down the line. So do you have any thoughts or advice on what we can do in the next 4 years at least and how to continue this really important work?
Well, I wish. I think it's important not to fetishize the role of the Trump administration in all this. This crackdown has been going on for a long time, since the beginning of the bombardment of Gaza. Our universities and our institutions have been cracking down on people who speak out against it. And this was under a Democratic administration. So, it doesn't take Republicans to do this, sadly. Democrats are perfectly capable of being repressive and are. So, this resistance work we have to do, we just have to get better at it.
There's a question written in the chat that I'll go ahead and read for those of you here in the room. It's from Linda. Here in Canada and the US, I believe, conscription of people is not happening, but conscription of our taxes is obligatory. And this funds the machines and actions of war, both here and abroad. Any thoughts about how to change this for those of us who object?
Yeah. So, there's always been a war resistors tax boycott. These are not legal methods, withholding your taxes. There are organizations, though, that work hard to publicize the use of tax dollars. There can also be a movement to have your various public bodies, Parliament, Congress, ask the public to vote on how they'd like their dollars spent. Wouldn't it be interesting if at the end of your tax return, there was a little box that asked you to prioritize where you would like your tax dollars to go? There were bills like this in Congress years ago, never passed, but worthy of pursuit. Political resistance is important. Whether material resistance is in your repertoire is a matter of how far you want to go. And some people, Quakers among them, over many years of history, have been willing to go that far. They subject themselves to arrest and prosecution. But maybe it's worth it to you.
Jail's not that bad.
Jail's not that bad, Tim says. Yeah, Tim.
Go ahead.
Thank you, Amy. My question is about the power at the top, say, just say FHS as an example, but any of these organizations, this university, our Board of Governors. The military-industrial complex was a major point that you made, how that control is working. And I wondered if you might comment on how that relationship, the money, impacts these institutions like APHA or SFU.
Or the University of Washington.
Certainly
Yes.
the University of Washington.
Yes, many academics rely on funding from the Department of Defense in the United States. And it's surprising sometimes to see that their grants and funding extend into all parts of the university you might never expect: breast cancer research, anthropology. How did we get the CIA torture program? It was through the Department of Psychology, funded by the CIA in Washington State, actually. And so our universities are very reliant and dependent on these sources of money. And, it's easy to say don't apply for these grants. And of course, many people do not. On the other hand, this is where the money is. We've got now $1 trillion a year in our defense budget and less in the budgets that fund useful things. Again, it's all about how we're going to fashion our resistance. And one of my current projects is putting out a new book called Conflict and Health, which will be published by a European publisher later this year, I guess. And we do have a whole chapter on the military and academia and ways in which this manifests. A lot of it is very anti-China right now. The military is very worried about China. That's America's big project right now. So there's a lot of money in American institutions aimed at hostility towards China, remarkably. There are many places where we have to show up and do this work. It's not going to be easy. Oh, we have a couple more questions online.
John?
Hello there. Hi, Doctor. I haven't got your name pronounced. Nice. Thank you. Thank you so much. This has been so instructive and I think so important. As a physician, there is a diagnosis, which is that conflict is unhealthy in every arena, personal to the global. The challenge is that we have a culture which neither sees that or values it at any great level. And I'm just interested in the sort of the real approach, because we're talking about changing our way of thinking. It's not just being against war, actually. We're actually for something that replaces that, which we're not sure what it would look like because we haven't had it yet. And I'm just interested in the dimensions of that task rather than just protesting we shouldn't be spending the money. I mean, we are talking about a fundamental change in our way of thinking, as Einstein pointed out with the splitting of the atom. I would just be interested, with that frame, what your thoughts would be. Where and how and what are the arenas outside of, just trying to get public health to see this that we need to focus on?
Well, so in one of my last slides, I think I said it's sometimes easier to imagine the end of the world than the end of war and capitalism. But we have to be able to imagine it. And we have to be able to imagine having international institutions that do the work, that resolves conflicts, and that sorts out power and wealth into more equitable distribution. And there's so much opposition to international institutions because I think the right wing understands that if these institutions really were strong, they really would distribute power and wealth more equitably, and that would threaten their interests. So, we all need to sort of be thinking big and be thinking about how we want to organize these international institutions and bestow them with more power and change the way the Security Council is able to shut down all these votes that happen in the General Assembly that have called for the ends of many wars unsuccessfully because they get vetoed by the Security Council members like the United States. So maybe that's a project some people are more interested in than others. It's hard to think about what's a handle for that. I like to think in my organizing around what are the handles we can attach to projects here. What's the handle for making our international institutions stronger? I'm not positive what that is, but it's time to start thinking about that. There's another hand up.
Yeah, this has really been stimulating, Amy. Thank you very much. Chuck Johnson from IPPNW in Geneva. I'm wondering. I'm getting the feeling that there is an exhaustion, a growing exhaustion in the United States, at least, but also in a lot of other countries with just perpetual war. And one of the strange phenomena of this last election was Trump as the peace candidate, and it's sort of taking advantage of that exhaustion and then immediately getting into becoming, latter-day Teddy Roosevelt or something, and within our
Right.
hemisphere, which is just
Go get the Panama Canal.
exactly. And just thinking that if we can beat up on little local countries, and take them over, that will still be popular or something, I guess. But I think he sort of blew his cover as a peace candidate. But I'm wondering if maybe we need to be talking to people on a little bit more simple level in terms of, aren't we sick of this? Can't we do better? The way you've described things is very common sense. And I think we all need to be thinking that way in how we're talking with our fellow citizens about what do we want to do to survive this century? Are we going to just keep fighting wars and killing each other and diverting our attention from the things we really need to do? Or are we going to do something about those things? And I think it's interesting that, for example, someone like Greta Thunberg took a stand on the Gaza situation, that people in the climate area are beginning to realize that if the world's perpetually at war, how are we going to address these climate issues?
Exactly.
So I just think there's a lot of, it's a terrible moment right now, but there's a lot of opportunity to explain to people how we could cure this thing if we would just stop doing some of these really stupid things, like fighting wars constantly.
Yeah. Yeah. And, you know, you'd think, especially among Americans, there might be some attention to the fact that we never win any of these wars. Doesn't that bother anybody? I mean, I don't know what it means to win a war exactly, but in no sense of the term winning would you say that any of these conflicts we've entered since Korea have resulted in anything that was really very beneficial for the United States or for the country we were defending or working on.
Well, Pete Hegseth thinks he has the answer to that. Is that we haven't let our warriors be brutal enough, you know, to win wars. That's what he thinks the answer is. So hopefully,
well, good luck with that.
We
Yeah.
won't find out what his theory, whether his theory, you know, how it goes into practice.
Pete Hegseth being Trump's nominee for director of the Department of Defense. Yeah, I mean, there are some clearly scary moments ahead. All right. Thank you all for coming. I appreciate the chance to chat with you. And imagine a world without war. That's your homework.
Thank you, everybody joining online.
Bye. Shall I press leave?